the doctor's dashboard. So as you can see, the doctor can see the patient's report, the triage, the laboratory, and the imaging, the diagnostic imaging, and also patient accommodation. So for the patient accommodation, they'll only see inpatient care, so patients who've been admitted to the hospital. So let's get started. So when they click the doctor button, they'll see the patients that are on queue for them to attend to. So for instance, Wenceslaus here is returning from the radiology. So from this statement, the doctor can be able to know where the patient is from. If they are coming from the nurse, it will say from triage. If they are coming from the pharmacy, if maybe the doctor had prescribed them some medicine, and then they visited the they got medicine from the pharmacy, and then they're back, it will say from pharmacy. So yeah, so that's how it works. So let's see Wenceslaus and the problem they're having. So when you click on a patient, all their information appears here, pops up here. So you can see their name, their age, their gender, and the number, their queue number, and their status. So from what you're looking at, you can see Brian Wenceslaus is an emergency case. Now initially these were the tests, the doctor's notes. So these were the notes that the doctor had made earlier on before they sent them to the radiology. So this was the assessment by the nurse. These are the results that came from the lab, and also this is the result from the radiology, the results, the scan. So the doctor can be able to access that information and do a prescription based on that information. So this is their diagnosis. So let's say malaria, for example. So the doctor can prescribe medicine, administer medicine, send them to the lab, or admit them to ward, so that they become an inpatient. So if they want to do any of the above mentioned actions, they just toggle this bar and then select the service. So if they want to do a chest x-ray, or if they want the patient to be tested for their chest, they just click on that service, and then when they click complete doctor consultation, the patient will be routed to the lab for that said service. So if they admit the patient to the ward, they'll just put the reason for admission. So say needs and complete. Once they do that, the nurse on their dashboard will see this patient needs admission, and they will assign them the bed and the ward according to the needs of the patient. So we don't need that right now, so we just leave them as they are. So if they want to refer this patient based on this information to a specialist, they just click here on any specialist they just choose, and then complete. Now once they do that, on the client information, it will be able to say that the doctor had referred them to a certain specialist, and they will get the care they need. So we don't need that, so we just click no referral and we complete the doctor's consultation. So once that has been done, so if none of these actions are taken, the patient is routed to the reception. At the reception, the reception officer will be able to discharge them, and if they've cleared the bill, it will appear there. If they have not, the receptionist will be able to know the amount they need to pay, and ask them to complete the payment so that they can be discharged accordingly. So yeah, that is the doctor's dashboard. So as you can see, they get to see more options compared to the nurse, also compared to the receptionist, and pretty much everyone besides the admin. This is the person who gets most access to the system. So yes.